You take most of these students who did that and who were extraordinarily, brilliant in their academic performance, when they were given a test to see if they could sustain attention on specific targets, it turned out they did more poorly than the average students. Okay, so multitasking, they were great at multitasking, which obviously is the case, but when they were given a simple task of sustaining attention, they did more poorly. So we don't know the long-term consequence of this. Obviously it must be, because there must be some consequences down the line, because you do need, we know for anything to be learned well, we need sustained attention. Anything, whether it's playing a particular sport, or whether you're listening to, trying to learn a particular music, or drive a car, or anything requires ability to sustain attention. Okay? So, so we devote quite a lot of time to that, and to the 2 weeks of reflexive abdominal breathing, and use it as a platform to first learn to place the mind and then hold the mind continuously for longer and longer periods of time. And we've also found that you can, as challenging as it is to sustain attention, there are many aids or concurrent cognitive strategies of activities. If you mobilize them concurrently, you learn much faster. One of which is working memory. Working memory lasts about 15 to 30 seconds. Working memory is that part of your memory where you have to retain the preceding information you have just attended to. You have to retain it, and a couple of them in order to come up with the outcome of the task you are attending to. Simple mathematics, if you give a division, if I give you orally a number, right, and ask you to divide it by 5, and then divide that answer by 2, you have to get the correct outcome, you have to retain in your working memory the first 2 numbers and their answers, so that while you are at the same time processing you are being fed the last digit, for instance. People who can do that better likely get the answer much faster. People whose working memory, in fact, actually disorders like ADHD, for instance, is turning out less, well, it is still a problem of attention, but it's turning out working memory problem is a more difficult issue than attention. And as a result of some of these findings, the new understanding is that sustained attention is not possible without good working memory. So the two are interdependent. You can't study sustained attention just by seeing if someone sustains their focus on the target successfully. You have to also monitor whether they are effective, how well their working memory is, because the more effective your working memory is while you are carrying out the attentional task, you are going to do much better. In other words, in our case, if you are reading an assignment, if you read paragraph 1, your ability to distill that information, capture the essence of that paragraph, retain that information in a kind of form which you manipulate. Each one of us kind of stores information most effectively based on our past experience and images and things that we kind of really know well. If you do that, manipulate the learned information, keep it there for the couple of seconds while you're reading the second paragraph, what happens is the linking between the two consolidates much more. and is likely to go into long-term memory. Otherwise, as you know, most of us, when we read paragraph 1 and we go to paragraph 2, and by that reading the next page, most of us have forgotten, what paragraph 1, 2, 3 really kind of, we're forgetting the essence of it. Why? Because we are not proactively using working memory. We are simply using sustained attention and say, oh, okay, I understand this paragraph, this is what it says, and then I go to the next, oh, I understand this. And what you have to do is stop after paragraph 1, make sure you encode that information. Encoding is basically storing it in the working memory in a form that you can easily remember. And then read paragraph 2, and the two will link. That's how the brain stores information, it's through links. And as a result, now we know that to train in sustained attention, you have to train in working memory. So if you want to learn sustained attention through mindfulness, use mobilized working memory. If you don't, you'll be like many meditators. Even in the Buddhist traditions, that's a big problem. Meditators will just focus on the breath continuously, and they feel like they are in touch with the breath, but they are not encoding the previous cycles of breath in their working memory, and so the learning is less effective. So when they get up and then next day sit, they feel like they are starting all over again. That's really, even you will find serious meditators who've been meditating 10 years, 5 years. If you really question them, they'll say each sitting is sometimes like as if I'm starting over. Why? My guess is they are not using working memory. They are really attending really well to the breath in the moment, right? It's like a parallel example is when you read your assignment, or difficult assignment particularly, you read the paragraph 1, paragraph 2, and if you do it that way, you'll find, particularly I myself have found it a hard way, because I write articles and I have to read a lot of papers to do that, and sometimes a kind of laziness creeps and narcissism creeps in, because you think, oh, this is so easy to remember, and that I can figure that out, I should remember this. But after a week, when I have to kind of coalesce and put the first paragraph together and recall, I am not able to recall, and I have to go back to search a couple of the articles and go through them. So the amount of time I'm wasting due to ineffective learning strategies, but even more important is not training the different parts of the brain. If you really want a healthy brain, we now know, the more you train different parts, the better off. It's not good enough to just train memory, for instance. You've got to train the executive part of the brain, the attentional part of the brain, the sustained, and etc. Okay? So I think classical mindfulness, and that's one thing we are kind of slowly trying to aim, is try to show that a lot of these vital components of good learning through sustained and distributed attention, working memory, that science, cognitive and neuroscience has established, actually very well structured and embodied in classical mindfulness. And so if you learn it, it's a little demanding, but it's of huge benefit. And then from a Buddhist perspective, and for those of us, for psychotherapy perspective, the second component of classical mindfulness is even more valid, which is the experiential insight that results from applying working memory, distributed attention, sustained attention, applying them effectively leads to reliable reliable, excuse me, it leads to reliable experiential insight. Experiential insight, by the way, is different from, to some extent, different from the insight that a therapist might provide you in therapy, right? Through their uncovering the unconscious motivation which is making you think and behave in a certain way, which we as patients may not be aware of, but the therapist uncovers it and then reflects back that information in the form of an insight. So we take it as initially as an intellectual experience until one day when it sinks in, it becomes experience. It becomes the intellectual insight becomes an experiential insight. Okay. So in mindfulness, one of the things we are trying to do is acquire insight that is based on personal experience that comes from practicing sustained attention into whatever object you are investigation. Initially, as I mentioned, we start off with the abdominal movement, but the goal is to then move on to your thoughts, to your feelings. That is the goal. It's called the 4 foundations of mindfulness. First is the physical, which is the breathing. Second is the thought, and third is the feelings, and then the fourth is how you focus on the adaptive versions of these preceding 3, which may be maladaptive in some ways, such as negative thoughts, negative feelings, distressing physical symptoms. Once you apply mindfulness to those 3, then you develop adaptive insights into them, and then develop adaptive versions of them. So these are the 4 foundations of mindfulness that constitutes the original classical forms of mindfulness. Okay. So let me see now. I'll stop here, for questions maybe. If you have any questions, maybe I can answer them. I'll try to, give you a sense of what we are trying to come up, we are coming up with our research at UCLA. Some of the conceptual frameworks, which are kind of pretty new, and we feel like some of the strategic ways to learn sustained attention are not only applicable to us, who are new to meditation or who are kind of gradually graduating, gradually developing our meditative practices, but also in the long run, my feeling is that some of this information could really be valuable to traditional practitioners in the East. They could benefit from what we know from cognitive science and neuroscience, understanding of sustained attention and distribute, how that could make it much more easier for them to facilitate the acquisition of sustained attention. Because even in the monastery, I know that, sustained attention is taught in a way where, unless you are well informed yourself, you might attend, learn, spend months and months just applying simply sustained attention on the breath and not having the skill to remember how working memory can help you make that learning so much faster. Yes?
Specifically on that point, when you're sustaining attention on the rising and falling of the abdomen in the breath, and the next step, as I understand it, is you want to encode that in some way.
That's right, that's right.
Could you elaborate on what you mean and how you would actually encode the rising, falling?